Good afternoon, everyone. Uh, Thank you for joining us at the Healthcare Revolution Conference. I'm Dr. Reshma Stanislaus, and I'll be your moderator for the next couple of sessions. So it's my pleasure to introduce Dr. Sivaneswaran Poobalasingam, who's our next speaker. Okay. Just before we start, I'll just give you a little bit of background about Dr. Siva. Dr. Sivaneswaran Poobalasingam was appointed as the lifestyle medicine expert consultant by the World Health Organization for the Lifestyle Medicine for Remission of Diabetes Project, for WHO and MOH. He's the founder and president of the Malaysian Society of Lifestyle Medicine and is the chair of the advisory board of the Lifestyle Medicine Global Alliance. Dr. Siva is also on the advisory board of the International Journal for Disease Reversal and Prevention. He's on the US-based True Health Initiative Council, the Global Positive Health Institute's Advisory Council, and the National Council Coalition for Mental Wellness in Malaysia. And he was also appointed as the exam question writer for the Lifestyle Medicine Board Certification Examination. Dr. Siva is also on the C20 Working Group for Integrated Holistic Health, NCDs, and is the CEO of Amrita Integrative and Lifestyle Medicine Center and Amrita Lifestyle Medicine Academy. And he was recently invited to the Global Lifestyle Medicine Leadership Forum, which culminated in the signing of the Doha Declaration. So without further ado, please welcome Dr. Siva to give us the next talk.
Thank you for the kind introduction, Dr. Reshma, and a very warm welcome to all of you present here today. This session from now till the end of the day today will be on lifestyle medicine. We'll have various aspects of lifestyle medicine being discussed. So we'll start with the role of lifestyle medicine in revitalizing healthcare. So the learning objectives will describe the core challenges of healthcare worldwide, and we'll discuss how to curb NCDs, and we'll discuss lifestyle medicine and recognize lifestyle medicine as the foundation of healthcare. So healthcare basically is the prevention, treatment, and management of illnesses and the promotion of physical and mental well-being via the services offered by the medical and allied healthcare. It is the world's most rapidly developing service sector, but unfortunately, healthcare is in crisis today. Why is healthcare in crisis? There are a couple of factors. One of it is that the rise in cost has become unsustainable. For example, on the back of the global pandemic, the healthcare spending in 2020 was about US 9 trillion, which is about 11% of the global GDP. So we are spending a huge amount of money on trying to get ahead of the game. Now, though we are spending so much of money, the healthcare system is not working effectively. In fact, there's a failure of the system to provide care to the population, resulting in higher morbidity and mortality rates. So then we go to the next question. So why is that happening, all right? Now, some of the reasons are there's an escalating increase in NCDs, an aging population. Then there are other issues like global shortage of healthcare workers. Malaysia is experiencing a similar situation. And maybe the medical culture these days where we over-investigate, where we over-prescribe, okay? But today, we are going to focus on the NCDs and we're going to talk about the aging population, right? Now, the world is seeing an epidemiological shift in morbidity and mortality from infectious diseases and malnutrition to NCDs, premature deaths, and living with disabilities. But unfortunately, our health system is not prepared for the rapid increase in NCDs and its associated disabilities. Now, the NCDs have been given the moniker tsunami of the 21st century, and again, talking about the cost, the global cost between 2010 and 2030 is expected to be US 47 trillion. And as a result of this, there was a high-powered UN meeting that led to the SDG 2030 goals, etc., which we'll discuss shortly. 74% of all deaths today are due to NCDs. And what are the common NCDs that contribute to these deaths? Cardiovascular disease, cancers, chronic respiratory diseases, and diabetes. And what is very important to countries like Malaysia is 77% of these deaths occur in low and middle income countries, affecting people like us in Malaysia. And let's talk a little bit about premature deaths. What do we mean by premature deaths? So premature deaths are death occurring before the age of 70. And again, we see a similar scenario. 86% of these premature deaths occur in low and middle income countries. And every 2 seconds, so I say 1, 2, and a person has died prematurely from an NCD, which is sad because it is a very preventable disease. Now, if we look at Malaysian statistics, well, we are not too far away from the global statistics. So in Malaysia, NCDs account for 70% of the burden of disease and 71% of premature deaths. And 16% or so of the healthcare budget is used on managing NCDs and almost half on diabetes. And why do we see so much money being spent on the management of NCDs? So if you have a look at the fact sheet here, all right, so you have 15% diabetes, 29% hypertension, high cholesterol, 33%. And if you look at the statistics on obesity, between 2019 NHMS data and 2023 NHMS data, it has gone up by almost 5%. Okay, so that's a huge increase, which is going to lead to the sequelae that we'll see in the years to come. So, if we summarize what we're talking about, NCDs pose a burden on not only health, but social and economic development. It has the potential to impact not the healthcare system as well as the economy of the country, and high treatment costs burdens families and governments. And we must also remember, we are talking up to now about direct costs. So direct costs is what we spend to get treatment. What about the indirect costs due to the NCDs? Loss of productivity, absenteeism, or presenteeism. That means people are at work, but they work at reduced capacity due to the illnesses that they have, premature retirement, and losing people at the prime of their lives, premature deaths. Now, the other issue is, other than NCDs, when we move on to the next problem that the world is facing, and Malaysia is, we are there too, is aging, right? So an aging population will carry with it the burden of NCDs. So this will increase the prevalence of NCDs and the mortality and morbidity associated with NCDs. Now, Malaysia is expected to become an aged nation by 2030, when 14% of our population will be 60 and above. According to the Khazanah Research Institute, currently 9.5 years of life expectancy is spent on poor health due to NCDs. Okay? So healthcare is in crisis. Obviously, there have been multiple remedies that have been proposed, but we still haven't kind of found the solution or confronted the core problem. Now, why is that? Because healthcare excels in acute management, and we are not very effective in treating chronic diseases. But unfortunately, the scenario today is 7 out of 10 deaths occur due to NCDs. All right? But we have excelled at, a prescription-based model. All right? So we are very prescription-based. We focus on symptom suppression. So we are not addressing the cause of the disease, and very, very importantly, when we talk about NCDs, is that we are not able to bring about behavioral change. So without behavioral change, we can't get ahead of the game with lifestyle diseases. We are not able to create awareness in the patients that they need to change their lifestyle, because one pill will not make them reverse their lifestyle disease. All right? Now, earlier I said that UN had this high-powered meeting, and they came up with UN Sustainable Development Goal SDG 2030. So the aim was by 2030, this started in 2015, okay? So by 2030, they wanted to reduce the premature mortality by 1/3. Now, according to the NCD Countdown 2030, which is a collaborative effort between WHO, NCD Alliance, Imperial College, and the Lancet, that many countries have made little progress in achieving these goals, and we are about maybe 5.5 years away from the target date. So where do we go from here? So how do we revitalize healthcare? So before we talk about that, okay, let's talk about something that all of us are familiar with. What is the common denominator of chronic diseases? I mean, it's a small group. We can, can give me some, suggestions? What's the common denominator? Everybody knows this. Sorry? I can't hear. Okay, so poor diet, all right? All this interesting food. We had interesting food just now, right? So if we have high calorie, low nutrient, simple carbohydrates, lots of sugar, lots of isolated fructose, all right? Saturated fats, a lot of animal protein. Where's the fiber? Can you find a fiber? Can you find fruits and vegetables? Very hard to find, right? Some little bit of green. Well, that's kind of the food that people eat. So this is an interesting study done by a Malaysian, and he looked at the dietary intake of Malaysians. So if we look at the dietary intake of Malaysians, carbohydrate intake is low. So don't get me wrong. It doesn't mean all carbohydrates are simple carbohydrates. So we take less than the recommended amount of carbohydrates, but look at our fat content, 29% on the upper limit. Look at our proteins, above the normal. Where is this protein coming from? From the image I showed you earlier, from all the animal sources. So we are overeating saturated fats, probably from animal source, of course, and all the fried stuff that we eat. Number of servings of vegetables and fruits very low. According to the National Health and Mobility Survey, both 2019 and 2023, adult Malaysians like you and me eat 95% of us don't eat the recommended 5 portions of fruits and vegetables. So we don't have to talk about the children, because we adults are behaving like children. So, right? Am I right? Okay. So, of course, so if the vegetables and fruits are low, we are not going to have fiber. So very low intake of fiber, 3 grams, when the target should be about 20 to 30. And our sugar is a whopping 28.5, all right, on the average, which is, WHO recommendation is 10 grams. For those who are, fit, if you have got illnesses, it's supposed to be about 6. So we know that a diet that is high in calorie, energy dense, and nutrient empty increases the risk of various diseases, because this type of diet will increase your inflammation, your oxidative stress, ectopic fats, okay, which will lead to lipotoxicity and also gut dysbiosis. Now, other risk factors, sedentary lifestyle, okay, lack of physical activity. I think the new NHMS studies indicate that 1 in 2 Malaysians lead a sedentary lifestyle. So don't forget, sitting is the new smoking. We have regulations for smoking, but we don't have regulation for sitting, prolonged sitting, right? Stress, lack of sleep, smoking, alcohol consumption, poor social connectivity are all risk factors, all right?